Reconstructive surgery encompasses a lot of things. A reconstruction would mean that we may need to reconstruct a breast which has been lost by cancer, or a patient who has lost part of his face because of tumor or because of any injuries that can be reconstructed. And then we also have patients who undergo certain tumor conditions which, after removing them, they end up with facial nerve palsy. That can also be corrected with the help of reconstructive surgeries. And in certain situations, you have gross deformities whereby the patient loses the whole of the face, the nose, maybe part of the ear, and the neck is stuck to the chest. In these cases, we can use techniques called as prefabrication, pre-lamination, whereby we can construct part of the nose or the face on the forearm and then transfer it as a microvascular tissue transfer and a procedure. So by doing this, we can actually rehabilitate the patients to a great extent. Like I said before, any physical deformity in any patient, can mar the confidence, and the patient may not be able to integrate well into the society as well as in interpersonal relationships. So these group of patients can be managed very well by reconstructing the lost part of the body and giving them back the will to live and integrate back into the society. Not only for the society, but it is also important for the person to be able to get back to work and carry out his daily routine in a confident manner. So reconstructive surgeries, again, it's like giving a life back to the person, because once the patient has lost a part of himself or a part of his body part, the patient would feel that he or she is not the normal person what he or she was before the accident or before this thing happened to him. So by doing the reconstructive surgery, you're basically restoring him his own original self and regains the confidence to lead a normal life. Other important thing is that he can also play sports, integrate with the society, interact with friends and families in a normal way. So a lot of surgeries can be done in these group of patients. One has to understand that reconstruction is not about cosmetic surgery, it is about restoring the function of the patient. A patient who loses his hand because of any trauma or any injuries can be reconstructed and give back the patient the function. Similarly, a patient who suffers from palsy, facial nerve palsy, is not able to verbalize, doesn't have symmetry of the face, we can restore that by doing some nerve transfers and some procedures whereby the smile of the patient is restored, and once he interacts with other people, they cannot make out whether something has been done or not. So I would like to say here that reconstruction basically involves restoring the patient's self, what it was before the accident or the tumor which removed that particular part happened. There are a lot of innovations and advances that have happened, and the first and the foremost is the use of artificial intelligence as well as computer-assisted design and computer-assisted management of these patients, whereby we do a 3D construct of the deformity and then we have a 3D print which can be used as a guide to restore the functional and the aesthetic part or the functional part of the body which has been lost. So by doing this, we minimize the chances of not being able to restore a part or a whole of it. So we can actually mimic the exact nature of the deformity and also reconstruct the jaws which have been lost because of tumors, and also give them a dental rehabilitation so that they look near normal and are able to eat and speak in a normal fashion.